Welcome to the WeRPN Self-Care Series, Physical Well-Being, this module focused on sleep, developed by WeRPN with the support of the Government of Ontario. Our agenda for this session will include a discussion on understanding what sleep is and why it is important. Then we'll review ways that you can improve your sleep. Good sleep is essential for good health and optimal functioning. Sleep is a recurring, reversible neurobehavioral state of relative perceptual disengagement from and responsiveness to the environment. Sleep health is a multidimensional pattern of sleep wakefulness adapted to the individual, social, and environmental demands that promote physical and mental well-being. Good sleep is characterized by subjective satisfaction, appropriate timing, adequate duration, high efficiency, and sustained alertness during wakeful hours. Busey further indicates that there are 5 dimensions of sleep that have measurable indicators of health outcomes, including mortality, chronic disease, and impacts to mental health, including depression and impaired neurobehavioral performance. Sleep duration is the total amount of sleep obtained for 24 hours. Sleep continuity or efficiency is the ease of falling asleep and returning to sleep. Timing is the placement of sleep within the 24-hour day. For most people, sleep occurs at night, but for shift workers, this may not always be the case. Alertness, sleepiness is the ability to maintain attentive wakefulness. Satisfaction and quality is the subjective assessment of good or poor sleep. Not only are these dimensions measurable, but they can be impacted by strategies used to improve sleep health that we will explore further. Good sleep is important. The benefit of adequate amounts of sleep include improved moods, supports physical health including heart health, regulating blood sugar, and immune system, an increase in mood changes of being happy, improved mental function, and stress relief. Conversely, poor quality or quantity of sleep can have the opposite effect, affecting our mood, our memory, and our mental functioning and physical outcomes. From the National Sleep Foundation 2025. Lichtenstein, page 790, notes that adults ages 26 to 64 require 7 to 9 hours of sleep, but not less than 6. And older adults, 65 plus, require 7 to 8 hours of sleep, but not less than 5 or not more than 9. Sleep can be difficult for many people, and there are many factors that influence both the quality and quantity of sleep, including lighting. While we're trying to sleep, can delay our internal clock, light can confuse our brains into thinking it is daytime. Shift work and jet lag. Many nurses experience the challenges of getting enough sleep while working shift work. While others are heading into work, night shift workers are heading home to bed, often in daylight hours, compounding the issue. Medical conditions or pain and anxiety. If you have chronic pain, it can be difficult to sleep since you're feeling the pain. Medical disorders may prevent you from falling asleep, from staying asleep, or attaining a restful sleep. Medications and substances, including caffeine, can also contribute, especially before going to bed, as caffeine works as a stimulant to keep you awake and alerts the body. When the body is alert, it won't go to sleep at a time when your mind needs to be relaxed. Also, environmental can include sounds and temperature, which can influence both falling asleep and staying asleep. Healthy Sleep 2025. There are various strategies you can use to help improve your sleep. Reduce blue light exposure in the evenings. While exposure to natural sunlight or bright light during the day can help to promote sleep, exposure to blue light in the evening can have the opposite effect. Avoid caffeine or other stimulants later in the day. Caffeine can both impact falling asleep, but also the quality of sleep. Avoid long daytime naps. Power or short naps can be beneficial, but long naps may impact your night's sleep. Incorporate a sleep schedule that works for you. Having a consistent time of wake and sleep cycle can aid sleep quality. Create a peaceful environment. Your environment is important. Low noise, dark, and an appropriate temperature for you. Use earplugs and white noise or meditation apps before bed to help you relax. Ensure you have a comfortable mattress and pillow. Avoid eating and drinking right before bed. Get regular exercise, but not right before bed. Rule out a sleep disorder. Ensure there are no underlying medical conditions such as sleep apnea impacting your sleep. Healthline 2025. As many nurses know, working shift work is commonplace in the healthcare environment, but it can lead to reduced sleep and insomnia and impact physical, mental, and safety performance. Insomnia and poor sleep in turn leads to excessive tiredness while you're at work. Shift work disorder not only causes cognitive impairments and physical complications, but also affects occupational performance and make workers more prone to errors and accidents. However, studies have shown that long-term night shifts have been associated with certain disease processes correlated with a lack of sleep. With the disruption to our delicate circadian rhythm, it can cause physical, mental, and safety issues. National Sleep Foundation. You can work towards enhancing your sleep with shift work by setting a restful environment. For those who must sleep during the day, this can include dark blinds to block out the light, earplugs, or a white noise machine. Ensure the bedding and room temperature are comfortable for you. If you can, put your phone on silence or on sleep mode. Set a sleep schedule. Treat your daytime sleep as though it is your nighttime sleep. Develop a routine of the same bedtime and waking time. Communicate this to your family and friends to avoid interruptions and help them understand that there will be some social events that you might have to miss. Monitor your alertness at work. Those who are new to shift work or work extended tours are at greater risk for making errors. Get up and move about. Try small amounts of caffeine or even a short nap during one of your scheduled breaks if you're able. If you consistently have difficulty falling asleep or staying asleep on shift work, especially if it's interfering with your work, consider consulting your healthcare provider. National Sleep Foundation 2025.